2021 agenda, 8:30 a.m. agenda. Members, thank you. First measure HB 826 relating to electronic smoking devices. Members, the recommendation of the chair is to move this measure forward. We're going to be putting in some savings clause in there so that way it addresses any concerns regarding retroactivity of the issue. And we're going to put a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 826, Chair's recommendation is to pass with amendments. Chair, Vice Chair vote aye. Rep Gates, excused. Rep Har,
Aye.
Rep Capella,
Aye.
Rep Lopresti. Sion. Not present. Okay, excused. Rep Nishimoto. Rep Ward.
Reservation.
Chair, your recommendation is adopted.
Thank you. Okay, moving on to HB 476 relating to taxation. Members, the recommendation of the chair is to move this measure as an HD1. We're going to make some changes into this. Members, we're going to insert language, a definition for a new product, which is actually going through potentially the federal approval process of a modified risk tobacco product. Members, we're going to put that definition in attached to, if it gets approval, that's specifically to the Secretary of the United States Department of Health and Human Services. And then we will be putting on that if a product of this nature is approved, that they would pay the state a 50% tax. Members, we will be also putting in Dole Tax Amendment number 2, as stated in their testimony regarding some language requests. And we will be making tech amendments and putting in a 7/1/2060 effective date. Any question, members? Yes, Representative Ward.
Chair, I think at the appropriate time, what you've said and what the bill says is probably appropriate. Right now, I don't think it's time to add taxes, particularly at the level that they are. And secondly, as one of the testifiers said, some of these guys are getting off tobacco and getting onto these. And thirdly, as an ex-smoker, I would say, given the downside of the social, psychological traumas that a lot of people, young people are going through, I mean, hey, if this saves a few lives because they can suck on one of these e-cigarettes, all the better versus what we're doing. For that reason, Mr. Speaker, Chair, I'm going to vote no on this.
That's fine. That is fine. Thank you. Members, any other discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 476, Chair's recommendation is to pass with amendments. Chair, Vice Chair vote aye. Rep Gates is excused. Rep Har,
Aye.
Rep Capella,
Aye.
Rep Lopresti,
Aye.
Rep Nishimoto, and Rep Ward is a no vote. Chair, your recommendation is adopted.
Thank you, members. Okay, moving on to HB 477 relating to cannabis. Members, the recommendation of the chair is first the following amendments. Just to note that we will be taking out language that in this measure that would authorize inter-island transport. So that would be located on page 17, section 3. We will not, that needs to be worked out with the federal regulations. So we'll be deleting that from the language. Members, we're also going to incorporate the following bills. The following bill, HB 482, relating to cannabis for medical use. That bill addresses propagules and cuttings. So we're going to actually put that and its limitations into this measure because this bill addresses B2B sales, which is business to business sales. And that measure also does this similar for a specific portion of the plant. Members, there was discussion regarding the fact that 4,000 grams was little over 9 pounds. Members, the chair we're going to move it down to 3,000 grams and continue that discussion moving forward. And we're going to be putting in technical amendments and a July 1st, 2060 effective date. Members, any discussion?
Chair,
Representative Ward?
so we're gonna put 482 and 477 together, is that?
Yeah. Not all of 482, but parts of it regarding what the definition of a cutting is and the limitations in that.
Thank you.
Okay, thank you.
I had a question.
Representative LaPresi.
Thank you, Chair. The changing of the weight, is that to apply to both classifications? Because I'm still a little confused personally on it. There was a couple of things that the grammage applies to.
So the weight would be at on the ends, the regarding the flour and that portion, the 4,000 that's in the current measure. And we're going to be taking on for the licensing and the limitations for the cuttings. They are doing it based off of 5. They're doing it by the actual number. So I think in 482, they were requesting the ability to move a certain specific amount of cuttings.
Okay.
Yeah.
Thank you, Chair.
So theirs one was no more than 10 in a 30-day period. So we're going to just move that same conditions over to the initial measure.
All right. Thank you for the explanation.
Okay, thank you. Wait, hold on.
Mr. Chairman,
Wait, sorry. Was it? Oh, and then okay, and then we will be taking out the primary caregiver authorized to cultivate cannabis, which is in section 329. That language will be deleted. Okay. Okay, hold on. Let's finish this measure first. Okay, so does that answer your question, Rep Ward? Oh, I mean, sorry, Rep Lopersi. Okay.
Thank you.
Chairman,
All right, got too many people asking me 10 different things. Okay, so on that note, we will finish. Yes, Rep Ward.
But what you just said raises another question. Did you say something about stacking, about you're gonna take out the
Stacking?
caregivers, something?
Yeah, so in the measure, there was language regarding caregivers, changing that definition, and we're leaving it as is currently in current law.
Okay, because you noted earlier that caregivers were giving their cards and stacking it, and kind of behaving like a dispensary.
So in this one, it'll be you would have to be business to a business ability to do this. Yeah. Okay. So that puts on that. Yeah. Okay. Any questions on that? Okay, Vice Chair.
Mr. Chairman.
Yes. Oh, sorry. Representative Har.
Thank you, Mr. Chair. Thank you so much for the recommendation. I do appreciate the amendments being made by the chair. That said, I found the testimony of the Department of Health extremely compelling. First and foremost, with respect to the fact there are only 2 inspectors who are really in charge of the entire program, and of course, this is an issue for finance, but I think that is an issue that still needs to be addressed. Secondly, I did find the testimony extremely compelling with respect to the fact that really only 36% of people are utilizing the retail dispensaries that we have, which I guess is relatively speaking low compared to other states. Again, the Department of Health really just doesn't feel expansion at this time is necessary. While I certainly understand issues of access in rural areas, nor do I mean to be, Oahu centric. I felt the testimony of the Department of Health was extremely compelling. So respectfully, Chair, I'll be going with reservations.
No, thank you. And again, and thank you, Representative. Just to highlight that we didn't put in a specified amount of increase. It's a blank. So there is that possibility that it could stay the same. And then on the first issue, my understanding in the governor's budget is that they wanted to transfer 11 positions under this branch. I think under the title as investigators.
Great.
So,
Chair,
yeah,
just
Representative Ward?
piggybacking Representative Har. Remember in the beginning, they said the black market was going to fade away, or it was going to be less. Now, when the statistic comes out that only 36% are using the dispensaries, something's going on in the market that we got either blindsided or naive or something, because they're using the black market more than they're using the dispensaries. Now, that's a flip on what we actually premised this to do, and for what purpose. So that's a very revealing statistic.
Yes. And then, again, to note that the dispensaries have been trying to, work with Department of Health to get these dispensaries open and functional. My understanding is it's been delayed for a number of reasons prior. And so again, um, we've been requested to look at this as in order to help make sure that those patients that legitimately get the medical marijuana card and need it for things like epilepsy and pain have fair and equal access. So at this time, this is the measure, and we have multiple opportunities to modify it as it goes through process.
Thank
Okay?
you.
Thank you. Thank you. Okay, Vice Chair, please take the vote.
Voting on House Bill 477, Chair's recommendation is to pass with amendments. Noting the excused absence of Rep. Gates, any reservations?
Reservations?
Kohar. And then
Carr
for-
vote reservations.
Reservation.
Rep. Ward vote reservations. Any noes? Chair, your recommendation is adopted.
Thank you. Moving on to HB 482 relating to cannabis for medical use. Members will be addressing it in the measure before, so we'll defer. Members moving to HB 1282 relating to the transition of the Oahu Regional Healthcare Systems from the Hawaii Health Systems Corporation into the Department of Health. Members, the recommendation of the chair is to move this as in HD1. We will be putting in the agreed upon conditions that HHSC Oahu region has made with Department of Health. This way, when the bill moves out, it'll give ample opportunity for entities like HGA, UPW, the health systems, and anybody interested to see what the agreed upon framework would be. So moving forward, so just to let you know, the whole specifics on that, on Leahi, Maluhia, moving out within a time frame will be inserted. We are going to consider the Attorney General's recommendations and how it fits into the language being currently drafted. And we're going to put in technical amendments and a July 1st, 2060 effective date. Members, any discussion? Representative Ward?
Sure, just a comment. I'm still not convinced that this is going to result in benefits and help the people of Hawaii. But we should see, because again, it's been years and years and years trying to get the HHSC straight and get Department of Health straight. We're still kind of playing around with organizational structure. So we'll wait and see. Till then, reservations. Thank you.
Okay, thank you. Anybody else? Okay. Representative Hart, you guys all good? Okay, Vice Chair, please take the vote.
Voting on House Bill 1282, Chair's recommendation is to pass with amendments. Any reservations? Oh, noting the excused absence of Rep. Gates. Any reservations? Any noes?
Just mine. You've got mine, right?
Said
Reservation.
reservation?
Yeah, you got it.
Okay. Rep. Ward votes reservation. Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to HB 1322 relating to trauma-informed care. Members, the recommendation of the chair is to move this recommendation forward to include the Department of Health friendly amendments and technical amendments with a July 1st, 2060 effective date. Okay, members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 1322, Chair's recommendation is to pass with amendments, noting the excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you. Moving on to HB 718 relating to health. Members, the recommendation of the chair is to move this measure forward as in HD1. We just need to put some tech amendments for clarifying language and then a July 7th, 2060 effective date. Members, any discussion?
Chair, in all due
Yeah.
respect to the author of the bill, I will not go reservations, but I suspect that this is a bit of demeaning to the businesses that are hurting, that we want to do a checkup on whether they're cheating. And I don't have any evidence in my district that that's going on, but let's see it through. But I think it's kind of kicking when they're down, because these guys are barely surviving. And if they can get a couple of guys on Medicaid and other food stamps, and they're still in business, I mean, we need that because we won't have any budget GT taxes or withholding taxes to give us life in the government. So with that, in all due respect to the best dressed in the room, I'll be voting for this.
Thank you. Okay. Vice Chair, please take the vote.
Voting on House Bill 718, Chair's recommendation is to pass with amendments, noting the excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to HB 576 relating to healthcare. Members, I've heard from a number of our colleagues with various inputs on the measure. Members, we're going to move this measure forward as an HD1. Members, on page 4, in section 3, part 2, the bill currently removes the hospitalized, licensed, and by the Department of Health or being operated at a federal government or agency thereof. Members, the chair feels that this is moving backwards, and we need those medical places to be approved. We've talked with the author and others, and they agreed that that language should not be deleted. So moving forward on the HD1, we're restoring that language. And members, there was some tech questions to clarify, so we're going to put in some language, tech language, to make sure that it's clear that this is specifically to aspiration abortion, and we're going to be putting a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 576, Chair's recommendation is to pass with amendments, noting the excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving on to the last measure, HB 988, relating to services for Kupuna. Members, the recommendation of the chair is to move this with an effective date of July 1st, 2060, and technical amendments. Any discussion? Okay, seeing none, Vice Chair.
Voting on House Bill 988, Chair's recommendation is to pass with amendments, noting the excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is
Okay,
adopted.
we are adjourned. Thank you, members.